Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. This is our community resource section, and my next guest is Rachel Smith, who is the Executive Director of the Refuge Clinic. Welcome.
Thank you. It's so great to be here.
So tell us, what is the Refuge Clinic?
So the Refuge Clinic is a nonprofit, and we provide free medical, dental, and mental health services to those that can't afford it. So it's free because we have hundreds of volunteer doctors, dentists, nurses, different people, healthcare professionals that are giving of their time to be able to serve those in need in the community. So those people that we serve are uninsured or underinsured in Jessamine and Fayette County.
Now, you said can't afford it, and that doesn't, that means they could have some help, but they still can't afford all they need.
Right. Access to care is usually a very challenging thing, but most people don't have dental care or mental health services available even if they have insurance. But for us, we're able to provide those things for free for those that can't afford it.
Well, tell me a little bit how the Refuge Clinic came to be.
Sure. It was back in 2007, actually, when we got incorporated. And quite frankly, Southland Christian Church, the leadership there asked the question, if our doors shut tomorrow, who would be impacted by that? And the answer was, well, people that attend would probably recognize that we're gone, but really the community might not. And so the heart was really to say, look, what would we be doing if we were trying to serve and be an example of Jesus? And so they decided to create a nonprofit. And so Refuge Clinic was birthed out of that to say, hey, one of the real practical ways that we can serve that I think is really biblical is to use healthcare as an opportunity to meet people right in their most vulnerable needs and respond with compassion and love. And that's what we get to do at the clinic.
So how do you access, if somebody needs to access it, how does that happen?
So you can reach us at our phone number, and you can call or you could stop in and ask for services. We do have a process. So again, our services, because they're free, we provide them for people that are uninsured or underinsured, that are living at 200% federal poverty guidelines, and that are living in Jessamine and Fayette County. And we just do that mainly to provide those resources for those that are most in need.
Now you have two locations, is that correct?
We do. Our Fayette location is actually attached to Southland Christian Church, and we're the left side of it. But then our Jessamine location is in the evening, and we partner with the Jessamine County Health Department to serve patients in the evening. And it's a really beautiful partnership because it's a great opportunity for them to use their facility and allow us to come in and provide, again, primary care for those that probably wouldn't be able to receive care where we're not there. So.
And you've got one on Richmond Road too.
That's correct.
All right. So if somebody wants to help, can they help financially? Can they help volunteers? What do you need?
Yes. Thank you for asking. I think that as we continue to see growth, we really do still need financial support. Our budget increased 20% over the last couple of years, which is amazing, but also it's because there's such a tremendous need. I think our growth, we're now seeing, we've seen over 3,600 patient visits in the past year alone, and now with the expansion of the mental health clinic, there's such need there. So supporting us, if there is an opportunity to support us financially, we always welcome that, and we also welcome volunteers that are like-minded, that are wanting to give and serve in their community. And specifically, I think we were talking about this earlier, we really need nurses right now, actually. We have a lot of incredible providers, doctors, dentists, psychiatrists, counselors. We still need everyone. We're welcoming everyone, but nurses is one of our biggest needs right now.
And you also, when you say money and donations, I mean, there's different ways to give, correct?
Correct. One of the ways you can give is online. You could also come and visit and get a tour of the clinic. I love giving people tours so they can see what's happening and get engaged. But there's opportunities to also donate supplies, things of that nature. But we also just recommend people contact us first so we can verify that that we can utilize those things that people are wanting to donate. But financially, if people want to give through the online giving or any other type of way, we like to work with grants and other things. And so sometimes people have connections and they say, hey, you really do fit what we're wanting to fund and to give towards. So we always welcome those opportunities.
They take stop, stock QCDs and gifts like that?
That's right. That's right. Absolutely.
And do you expect now, with benefits being cut, going down, you expect your need to be greater?
Absolutely. That's what we're already seeing. You know, I mentioned at the beginning of this year, we opened our mental health wing, and Kentucky, I mean, there's only, I think it's like 22% of Kentuckians actually struggle with a mental health issue, and only 30% really actually get services, actually get care that they need. And so we're really seeing that there's a tremendous opportunity to serve there, and we see that growth, and we're excited to be able to fill in the gaps, but quite frankly, the need is bigger than what we can do.
It's a big job, but we thank you for all you do.
Yes.
And for the Refuge Clinic.
Thank you so much.
And thank you all for watching. And if you'd like to watch this episode or past episodes, you can access them through the Family Practice Associates website and their YouTube channel at fpalex.com. It'll also be released as a podcast, and you can find that on where you get your podcast on Apple and Spotify. Again, thanks for watching. Join us next month for more great healthcare information on Family Practice.